Assalamualaikum warahmatullahi wabarakatuh. Hello, everybody. I would to introduce myself. My name is Natalia Jayanti Mandasari. I'm student from Harapan Bangsa University, Indonesia. Now I want to share my research. And during my research, I was helped by my lecturer, is Mrs. Nurjuni Datriana and Mrs. Murniati. Okay, my research about the effect of audiovisual therapy on anxiety level of pediatric patient in RSUD Aji Hospital. Introduction. Children are individuals who have limitations in adapting to situations that are believed to be threats so that they can affect their lives. Special attention to children as individuals who are still in the age of growth and development is very important because childhood is a process towards maturity. The process is child growth and development can be hampered by several conditions, one of which is a sickness and require hospitalization. Sickness and hospitalization that occurs in children can cause stress and anxiety. There are several factors that cause anxiety during hospitalization. This is from doctors, nurses, new environments, and invasive measures. One of invasive procedures that often cause anxiety is infusion. Infusion installation aims to replace fluids and insert injection therapy according to doctor advice. Infusion is a procedure that causes discomfort and pain, causing fear and anxiety in children. Anxiety in children can manifest in children as compliant for multiple somatic. Example, abdominal pain, nausea, diarrhea in children. This condition will store memory in children and until adulthood and then to stay. Rias et al. India. There are several things that a nurse can do so that children are cooperative when an infusion is performed. One of which is by diverting anxiety and fear to something fun, so that the infusion process runs safely and smoothly by inviting them to play. Triana explained that the game is an effective media for adapting because it has been proven to reduce fear and anxiety during the hospital treatment process. Audiovisual play therapy can be categorized as a distraction technique, namely as non-pharmacological technique that can be done by nurse. Trepa et al. Explained this technique provoked a child consciously to use hearing, sight, tactile, and kinesthetic that be effective distraction to minimize stress associated with painful action. Research methods. Design used in this study was pre-experimental with a one-group pre-test and post-test design. The sampling technique is non-probability sampling with consecutive sampling technique, with a total sample of 42 respondents, pediatric patients aged 2 until 6 years who received infusion on Kapodang Atas Room, RSUD Aji Hospital. Pediatric patients who are conscious can be invited to communicate, do not experience hearing loss, do not experience visual impairment, mental retardation, and do not experience symptoms of COVID-19. The instrument used in this study was the visual analog scale anxiety. Data analyzed in the form as a frequency distribution table based on gender, age, first or many times hospitalization, anxiety before and after audiovisual playing therapy, and effect of audiovisual playing therapy on change in anxiety level. This is my result of the research. Respondent characteristic is number one, age. The highest number in the age of 3 years, or we can call them a toddler. The reason in toddler increases motor skill that can result in injury, so that it requires treatment more often. And then in toddler, immune conditions are not good and are not optimal. And then unsuccessful toilet training in toddler can be one of the reasons children are hospitalized. For example, using diapers at toddler age of a long period of time can cause UTI and constipation. And then number two, gender. The highest number are women. Yes, the reason women prioritize feelings, have a weaker physique than men, and are more sensitive, so that women are more responsive to a condition that is dangerous to themselves. And then about hospitalization, the highest number is that first hospitalization. The reason is because there is no experience in adapting to health workers in patient rooms and various invasive action causing fear and anxiety. And then the result about anxiety level. Anxiety level before audiovisual play therapy with the highest number of respondents is high anxiety, yeah, or panic. Infusion is an invasive procedure that causes anxiety and fear reactions in children due to a painful reaction when a needle is inserted. This condition is a threat to children because there are still limitations in adapting and coping conditions that have not been maximized. Anxiety reactions that appear are crying loudly, screaming, hating, running out, holding tightly to her mother, pale, tense, increased breathing, sweating, bedwetting, silent, and unwilling to answer questions. And then result about anxiety levels after audiovisual play therapy. The higher number of respondents was in mild anxiety. Mild anxiety. That is. The reason is play is the important part of growth and development. Audiovisual play therapy is a therapeutic process that uses media, hearing, and seeing that provide a pleasant effect. And this is a table of different between anxiety level before and after audiovisual play therapy. This table, uh, the anxiety scale before audiovisual play therapy has the high scale of 10, maximum 10, and the lowest scale of 4. 4. And then the anxiety scale after audiovisual playing therapy has the highest value of 6 and the lowest value of 0. And then this is a table about Wilcoxon test. Negative rank or decreased result from before the experiment to after the experiment. There were 42 negative data, meaning that there were 42 respondents experiencing a decrease in anxiety level from before the experiment to the after experiment. And then positive rank or increase in result after the experiment and before the experiment is 0. This is 0. And then ties or similarity of pre-experimental and post-experimental values have a value is 0, which means that there is no equal value between pre-experimental and post-experimental result. And then the result of Wilcoxon test statistic. Then this is the important statistic. The result of the output test statistic on the Wilcoxon test, namely a SAM 6 to Tyler, is 0.000, or this is meaning less than 0.05, meaning that hypothesis is accepted. Less than 0.05, which is the point. Conclusion, there are effects of audiovisual play therapy on the level of anxiety in child patient during infusion in the Kapodang rooms, RSUD Aji Barang Hospital. There are effects. Conclusion, number one, the level of anxiety in pediatric patient in the Kapodang Atas room at RSUD Aji Barang Hospital before being given audiovisual play therapy mostly experiment anxiety with a total of 17 respondents, or 40.4%. Number two, the level of anxiety in children in the Kapolda Atas room at RSUD Barang Hospital after being given audiovisual play therapy, most of the respondent anxiety level were in mild anxiety, 35.7%. And number three, there is an effect of audiovisual play therapy on the level of anxiety in children aged 2 until 6 years in the Kapodang Atas Room RSUD Aji Barang Hospital. It is proven by the result of the output test statistic of the test. Wilcoxon assigned site to target is 0.000, or less than 0.05, meaning that hypothesis is accepted. So, it can be concluded that there is an effect of play therapy on the level of anxiety in pediatric patients at the time of infusion in the Kapolda Atas Room RSUD Aji Barang Hospital. About audiovisual play therapy in this research. Audiovisual play therapy, audiovisual distraction, because it provides a diversion from something that makes you uncomfortable or anxious by displaying moving image and sound, thus ignoring the comfort. This distraction process causes the release of endorphin, which inhibit the action stimulus that is transmitted to the brain, as well as causing stable neurohormones that affect endurance and reduce anxiety. This therapy does not conflict with current treatment therapy, does not require a lot of energy, and does not take a long time. These are some pictures during the research of measuring anxiety level visual therapy to measure anxiety after therapy. We can see in the experience this respondent. And then thank you for attention and thank you for a time. I hope the research is useful in nursing. Thank you. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.